Good evening, guys. Please just raise your thumb to let me know that the audio visual is okay. So I hope I am audible, all clear, visible, and the board is nicely visible to you. Perfect enough. So I think everything seems to be going well. So I'll just quickly introduce myself first to you guys. I'm Dr. Mukul Mohindra, your orthopedic instructor at Unacademy, and today I'm here because I just thought of discussing an interesting area with you, the sclerotic bone disorders. So please quickly gear up to move ahead with the discussion on this particular area with me. Sclerotic basically means whitish. So there are some diseases in which the bone would turn totally white. So that's what I intend to discuss with you, that what all conditions the bones would generally go white, but bones go white does not mean that they go stronger. Rather they go brittle, they fracture, and they actually trouble up, creating problems, bringing you to the orthopedic surgeon. So without wasting much of time, because it's a short session, I'll just quickly start with discussion of a couple of questions and explain them the answers. So when infants come to you, the problem is failure to thrive. So there seems to be something serious. The infant's got hepatosplenomegaly, frontal bossing. So this bossing means thickening. The blood picture says there's pancytopenia, and an X-ray image is shown here very nicely. Okay, I hope you can pick it up. It's little whitish side of the bones. So bones are looking little whitish, sclerotic, because that's what we are discussing today, the sclerotic bone disorders. Now looking at these x-rays, you have to tell me the possible diagnosis, the most probable diagnosis. Well, mind you, if you will just observe carefully, you will find a very, very classical rather deformity is visible here, and that deformity is even enough to tell you the diagnosis, provided you can pick it up. So can I have some people trying the diagnosis here? So is this a case of scurvy, osteogenesis imperfecta, osteopetrosis, or achondroplasia? So can I have some people helping me out with the answer here? So just go through the question, please submit in your choices. So people watching, okay, so wonderful. So your messages are visible to me, so quickly drop in your choices so that I can take you through the answer also. Alright, so to help you out with this part, okay, so fine enough. So achondroplasia, Doraemon, I'll help you out with this, not a problem. See, problem with scurvy and osteogenesis imperfecta, that there is defective collagen in the body. In osteogenesis imperfecta, there is a genetic defect, while in scurvy, vitamin C deficiency leads to problem with collagen formation. Now when the collagen is going to be defective, the bones are never going to be sclerotic. They cannot be whitish, rather they will be on the lytic side. So these options are totally out. So in a simple way, I am just between these two choices now. And let me tell you, achondroplasia, this is basically a skeletal dysplasia, and it had its own characteristic, full characteristic appearance and signs. Someday I'll be teaching you about skeletal dysplasias and I'll be talking about what happens in achondroplasia. But going by this history, this would be a much better answer, osteopetrosis. If we'll go through the achondroplasia part, it's not a sclerotic bone disorder at all. Okay, so it's the fibroblast growth factor that is deceptive, and it basically leads to dwarfism. So that is the, you know, category into which achondroplasia goes. Okay, and you won't find these kind of things, so easily. Pancytopenia, failure to thrive right at birth, in a skeletal dysplasia, because skeletal dysplasia would manifest with growth. So this is classically a case of osteopetrosis. But let me explain this frontal bossing, this hepatosplenomegaly, this pancytopenia to you by taking you through what is osteopetrosis, something that's also called as Elbers-Schönberg disease. Okay, champagne glass. Okay, not an issue. So I'll come to that champagne glass part also. See, osteopetrosis to an orthopedic surgeon would mean pathological fractures, because the bones here tend to be brittle. Osteopetrosis to a radiologist would mean these classical deformities. So what you see in this first image, we call it endobones. I'm sure you can pick it up. The classical appearance, bone within bone. So you can pick it up very nicely. There's a bone, and within this bone there is a bone. So this bone within bone appearance is what, classically, how classically a radiologist will pick this up. And another very classical way by which you can pick it up, the Erlenmeyer flask deformity that you may have in the distal femur. I hope you can very well see the distal femur here is flask shaped, and perhaps it was very much flask shaped here also. So that Erlenmeyer flask deformity is encircled here for you. So these are the classical ways, with which a radiologist will pick this condition up. Now let me tell you, not uncommon for these people actually to end up with a hematologist or with a physician. And then the problem here is pancytopenia, hepatosplenomegaly, and not uncommon for these people even to end up with the pediatrician, because at times they tend to be infants who have this problem, failure to thrive. So this is a condition, that runs through so many branches: orthopedics, radiology, medicine, hematology, pediatrics, because it has a constellation of symptoms that span across all these branches. And if you want me to connect all these symptoms with a single word, I'll even do that for you. I would even do that for you. The one line that connects all these three things, that's defective bone remodeling. Defective bone remodeling. So that's what leads to all these problems. I know you'll be thinking that defective bone remodeling, how would it lead to this hepatosplenomegaly, pancytopenia? I'll explain that to you. See, the basic problem in osteopetrosis, that there is a defect in these cells, osteoclasts. Now you're very well familiar with these cells. These are the same cells that resorb bone. So basically these osteoclasts, they have a problem in this carbonic anhydrase proton pump enzyme type 2. So this particular enzyme is defective. Now you're very much familiar with the function of osteoclast. They tend to resorb bone. So bone resorption is not there. Now bone resorption is required for bone remodeling. So because of this, the bones cannot remodel properly. So eventually what happens to these bones, that they end up becoming thick and white. So that's why we also at times call this condition as classically the marble bone disease, because bones are whitish, or even osteosclerosis fragilis generalizata. So osteosclerosis, marble bone disease, osteopetrosis or Elber-Schonberg disease, all synonymous. Now I was supposed to connect all the dots for you. So with this line, now I will connect everything. Now when the bones become thickened, okay, because their remodeling is defective, they become brittle. So because of the fact that bones are brittle, they easily fracture. Second thing, these thickened bones encroach on marrow. So when they encroach on marrow, marrow is gone, so pancytopenia. Marrow is gone, so hepatosplenomegaly occurs for that extramedullary hematopoiesis. And because of that pancytopenia and anemia, the infant will have failure to thrive. And because of that bone resorption that is not there, pathological fractures, defective bone remodeling into endobones. Defective bone remodeling is what generates this Erlenmeyer-Flass deformity, because femur cannot shape up properly because there are defective osteoclasts. So I hope you guys are thoroughly clear with the spectrum of osteopetrosis. You understood the classical clinical features here. You've understood the reason behind these clinical features. You've seen these things on the x-rays that are diagnostic, and you've understood the whole spectrum how osteopetrosis results. Well, let me tell you, in osteopetrosis there's a benign form, okay, this is autosomal recessive, and there is a malignant form. So this is autosomal dominant, the malignant form is autosomal recessive, okay. So it is the malignant form that troubles up the infants. So I think perhaps the x-ray that was shown to you was of the malignant form. When such a scenario is encountered, for treatment what you need is an early bone marrow transplantation, okay. So with that early bone marrow transplantation, you are able to give that person a chance to live. Otherwise, benign form you can still lead a life. Malignant form, very dangerous. So early in life you have to prepare this infant for a bone marrow transplantation. So clear enough, guys? Can I have the thumbs up from you guys if you're clear with osteopetrosis, its spectrum? You've understood what this disease is, you've understood all the names of osteoporosis, you've seen these x-ray images, and you'll be able to pick them up in your exams. Yes, Asifa, Doraemon, RR. So I hope you guys are thoroughly clear with this part. And any clues about the causes of Erlenmeyer-Flass deformity? Any clues? Okay, no problem. So just jot this down. So this Erlenmeyer-Flass deformity, okay, this is classical for actually Gaucher's disease, but many other conditions can have this deformity. Okay, I think last word is not visible to you here. Maybe little problem with the display. It's fibrous dysplasia also, you can have this deformity. Okay, so these are all the causes of Erlenmeyer-Flass deformity: Piles disease, osteopetrosis, achondroplasia, thalassemia, Olier's, rickets, RA, Gaucher's. Okay, perhaps achondroplasia is also one of the cause of Erlenmeyer-Flass deformity. Perhaps I think that is why that was amongst one of the choices, and that's why it was a close call. Clear enough? Okay. All right, Nisha. So thank you for introducing yourself. So I hope things clear enough to you, able to understand and grasp all this. Wonderful. So as I finish up this part, osteopetrosis, just sharing a small MCQ with you. Let me see if you can pick this up. Osteopetrosis is characterized by all of the following except. So you have to tell me the false statement. So Nisha, give it a try. Asifa, Doraemon, so please give it a try. Yes. Nisha's 3. Asifa, Doraemon, just give it a try. Any idea which is not correct about osteopetrosis? Anyone? I hope you've gone through this question. So osteoporosis, you've understood it very well. So what is not correct? Overgrowth of the calcified bones, increased susceptibility to fractures, hypercalcemia, the presence of brain isoenzyme creatine kinase in the serum. Okay, no problem guys, I will help you out with this one. The bones are calcified, white, correct, no doubt about it. The bones are brittle, thick but brittle, so they fracture easily, correct. There is hypocalcemia, no. Rather in osteopetrosis, you have hypocalcemia. And why hypocalcemia? Because there is no bone resorption going on. Osteoclasts are defective, so how would calcium come from bones to blood? And you have this enzyme present in the serum, absolutely correct. So this is the answer. But I hope with this I have given you 2 more points with which you can lead yourself to the diagnosis in cases of osteopetrosis. So you can measure this brain isoenzyme creatine kinase in serum, that will guide you to the diagnosis, and the blood picture will show you hypocalcemia. So clear enough guys? So I hope you are now fairly clear with this disorder, osteopetrosis. So just another spotter for you. So again, densely white femur, densely white tibia. So all of the following can be the diagnosis here, except what is what I want you guys to answer me. Okay, so meloriostosis, osteopetrosis, pycnodysostoses, Paget's disease. So which is not the correct choice here? So let me tell you again, all close calls, but one of them is less likely here. But I hope you can see absolutely white femur and almost looking like that Erlenmeyer flask. Alright, no problem, I'll help you guys with this. Paget's would be the least likely answer from my side here. But other things are very much possible, because it is like dense white bones you see right in this X-ray, and these all are sclerotic bone disorders. In fact, I'll just give you the list only. Like what all conditions come under this group: sclerotic bone disorders, osteopetrosis, osteopoikilosis, osteopatha striata, meloriostosis, Caffey's disease, and pycnodysostoses. Okay, so pycnodysostoses, meloriostosis, they are all in the picture. Osteopetrosis, meloriostosis, pycnodysostoses. So this is also there, this is also there, this is also there in white bone disorders. Okay, so that's how I took out Paget's disease. Paget's disease, I'll just take you through the X-ray changes in a little while, don't worry. But this X-ray was not showing the classical changes of Paget's disease. I'll take you through them also. And in these sclerotic bone disorders, please do not forget fluorosis also forms an important part. Fluorosis. What basically happens over here? Fluoroapatite crystals replace calcium. And the most important part, they replace calcium in teeth and they replace calcium in bone. See, calcium is what gives you strength, makes you hard, and two most hardest things, teeth, bones. So both of them have calcium. Now when calcium is replaced by fluorine in teeth, the teeth become chalky white, and when fluorine replaces calcium in bone, the bone becomes dense white. So fluorosis is another classical condition with white bones. Clear with it? And yes, an important point. These dense white bones in fluorosis, they are classically showing you hyperostosis. Hyperostosis means calcification at the attachment point of ligaments, tendons. So that's exactly what we say is hyperostosis. And diagnostic in cases of fluorosis, calcification of the interosseous membrane. So even the interosseous membrane gets so calcified and becomes white. So that is like diagnostic, so that is a sclerosis. these fluorapatite crystals cannot be eaten by osteoclasts. So that is the whole problem here. The teeth are becoming white, bones are becoming white. I'll just show you here also. Look at these white bones. Look at these white bones. So classical areas involved in sclerosis: pelvis, spine, and as I told you, the diagnostic area, the interosseous membrane. So I hope you can very well pick up this whitening of the interosseous membrane. So these are some of the classical ways by which you pick up fluorosis. Perfect enough? So I hope we are done and dusted with few of the sclerotic bone disorders. So I'll just carry you further and even take you through a little bit of this Paget's disease. I'm sure you would have heard of this Paget's disease, and I'm sure you would have read it at least in ENT, if not in orthopedics. And you must have read about deafness in Paget's disease. So can I have you guys helping me out with this one? That if there's deafness in Paget's disease, what does the ENT people say? What is the probable cause? Is it that thickened cranium? Is it the narrowing of the foramen of the skull? Is it brain compression? Is it otosclerosis? Okay, so please just let me know a little on your opinion from ENT side as well. Let me tell you, Paget's disease you generally find after the age of 40 years. So it's a disease of old age. The male and female ratio is like almost neutral, equally common in the males and the females. Okay, but yes, it has again a spectrum of changes. But any idea what is the cause of deafness? Okay, not a problem, I'll let you know. It's actually classically otosclerosis. Although narrowing of the skull foramina, the thickened cranium, brain compression all contribute, but this is the most consistent reason that you find in almost all cases. I'll just take you through the spectrum of Paget's also. See, if you ask me to define Paget's in just like one go, I would say this is a disorder of abnormal bone turnover. And I would not just say abnormal, I will use the word rather excessive for it. So what I mean by that, I'll just clear it up to you. So first of all, there is an increased amount of bone resorption because of some unknown reason, and to match it, there's almost an equal rate of bone formation. So both things go up. So that's why I said abnormal bone turnover, because turnover is excessive. More absorption, more of formation. Hence, this disease tends to go through phases. So there will be a lytic phase. Bones will be becoming lytic initially because of increased resorption, and then the blastic changes come up because bone formation is stepped up. So in comes the osteoblastic phase, and then the final phase is called the burnt out phase. And in this particular phase, burnt out phase, you can have sclerotic bones. So even Paget's has some link to the sclerotic bone disorders. At least the burnt out phase can be whitish. In Paget's, the bone that would mostly be involved will be pelvis, closely followed by tibia. So these are the areas of involvement by Paget's: pelvis and tibia. Like in fluorosis, it was the interosseous membrane. Although other bones can also be involved, and even though vertebra can also be involved in Paget's. In fact, I'll just take you through the classical X-ray signs of Paget's, the classical X-ray signs. So these are the signs that you may find in that lytic phase, and these are the signs that you may find in that blastic or the burnt out phase. And I don't think I need to tell you what these signs are all about. See this vertebra like a picture frame. So this is what we say is a picture frame vertebra. Okay. See this whitish iliopectineal line, this is called a brim sign. See this massive patch of osteoporosis. That's what you call as that osteoporosis circumscripta. Then let me tell you, some people, some laymen I would say, they simply call this as a cotton wool spot. Synonymous. Yes. In the lytic phase, bone resorption occurs. So can you see this bone resorption going forwards, advancing, and it is forming this V-shaped shadow on the X-ray. This V looks like a blade of a grass. So you can also find blade of grass appearance in this lytic stage when there is bone resorption going on. So these are some of the classical signs that tell you this is Paget's disease, and this should be there in the older age group. Okay, so I hope you're clear with a little bit about the Paget's disease. Also, you've understood about few of other sclerotic bone disorders. Any queries from the area I have covered till now? कोई चीज़ समझ में ना आई, you want me to repeat again? I hope I was clear now. Okay, so if you don't have a query, I'll tell you a word about the treatment in Paget's disease also, because we have 2-3 minutes. Plicamycin. This was like a revolutionary agent that came for the treatment, an antimitotic agent, very much like the COVID vaccine. It came with a bang, but was turned down, not very universally accepted. So this was the older gold standard, not now. So now if you ask me the drugs of choice, I would say bisphosphonates. And although this is a huge group, to be specific, etidronate is the one that most of the doctors prefer. Now in Paget's, not uncommon is to find the spine involved, and if you have the spinal involvement causing pain, then let me tell you, a drug to which the spinal pain would beautifully respond, calcitonin. So these are some of the things that work if someone lands up with Paget's. For an orthopedic surgeon in Paget, the problem is very simple. It's pathological fractures, because again there is excessive bone turnover going on, so bone remodeling is defective. You will have thickened bones, and you will have thickened cranium. You would have osteopetrosis like changes, sclerotic bones also at times. Okay, so from my side, pathological fractures are a big concern, but for ENT people, because of this otosclerosis and sometimes narrowing of the skull foramina, deafness is also a problem. So this is the spectrum of changes that you may find in people with Paget's disease, and I hope you're clear with the treatment part also. So anything not clear to you guys, or can I pack up? So can I have the final thumbs up if things were clear to you? You were able to grasp a bit of osteopetrosis part, you were able to grasp a bit of Paget's disease part, you understood the mechanics behind these diseases, you understood the treatment part, and you understood the spectrum of clinical changes, and you have seen the classical X-rays, because a number of questions in your exams are now images. Fine enough. So I think things are clear enough to you guys. So in case you wish to read more from me, please download the Unacademy app. Just go for the plus subscription, and you can access everything within the same subscription. In case you don't want to go with the plus subscription, you want to still maximize your benefit, then combine Unacademy with Prep Ladder, go with the iconic subscription. Okay, the subscription price is very, very economical. So just taking you through some of the batches coming up. So anyone who's preparing for NEET PG 2023, this is the batch you have to join. Might it be that it's the next pattern of the exam that you have to tackle, so we'll make sure we give you the training for next also. Okay, so people interested in joining the test and discussion batches, there are batches coming for you guys also. Please pick your dates. Okay, so subscription prices right now, we have good amount of discounts going on. In case you wish to use, you can use my code also, OrthoLife, okay, to get the discount. and the prices are going up. They are going to be increased very soon. So please don't wait. In case you wish to subscribe, go fast and subscribe and be a subscriber. We'll be looking forward to seeing you there on Unacademy. So thank you for your patient listening. Thank you for the lovely smileys. Okay, I'm obliged. So we'll be looking forward to having you as subscribers on Unacademy. Any doubts you have or you wish to communicate to me, this is a Telegram group I run. So you can connect to this group and inquire for a query. So wish you all the best. Good night for now. Bye bye.